Hi, Amber Weber-Gonzales here with Prosperident, and I'm so excited today to talk with Alyssa Kimmins, my colleague, and also a fellow hygienist just like me. And the reason that we want to talk to you today is because our theme and focus that we want to talk about in the dental world this month is spring cleaning. And of course, as previous hygienists in the dental hygiene world, we have a lot of experience with the goal and the theme of spring cleaning. Alyssa, what are your thoughts about spring cleaning and how it relates to the financial world?
Of course, as a hygienist, we love everything to be clean all the time. We are all about prevention. We're all about staying in front of any troubles before they happen. So, with us in the dental world and in the financial world, what we want to see is we want to see you staying in front of the situation at hand. Why wait to have an SRP when you could just have an adult pro fee every single 6 months and stay in front of it?
That's exactly right. So it's about prevention. And the same thing applies with your finances. Similar to patients denying x-rays, without x-rays, you can't properly diagnose. The same principle applies in your practice as an owner. In order to properly diagnose, you need to have a detailed view of your finances and see realistically what's going on underneath and hidden vulnerabilities you might not even realize are happening.
Along with that same line, the idea behind here is if you want to have patient compliance and following the instructions you give them when it comes to prevention and whatnot, wouldn't you want to do the same for yourself? Don't you want to hold yourself to that compliance as well and stay in front of that transparency? Stay in front of what's going on within your practice and your billing needs to make sure nothing's going on that you're not aware of.
Absolutely. It's just kind of like plaque versus years and years of buildup. Plaque can be small financial errors that do not disrupt the operation of your practice. But if you allow financial issues to continually occur, then the buildup also, just like in your mouth, continues to occur. And it's a much bigger problem to fix and even understand how or why this occurred.
And let's take, for example, as time goes on, it's so much easier when you're staying in front of things. You get that plaque off, but when you're starting to look at tartar, when it starts to get subgingival, when you're going to the root of a pocket, you can't get that nearly as easily as you could if it were just on the surface level. Same thing with your accounts receivable. When it's 60 days out, okay, not the end of the world. Easier at 30 days. However, if you start reaching 90 days, 180 days, it gets harder, harder, and harder, and it's only going to grow bigger. Patients are going to be more unhappy when they receive the statements with larger bills over time. And your office is going to be just overworked trying to catch up on what they should have been doing the whole time anyway.